To HIV/AIDS, the US President's Emergency Plan for AIDS Relief, PEPFAR, has invested millions of dollars in different projects, as well as by promoting public-private partnerships, that's PPPs, as a priority element strategy to combat this deadly disease. Now, as World AIDS Day is commemorated today, it is an opportunity for people all over the world to unite and fight against HIV and AIDS. World Health Organization has estimated that over 35 million people are living with the virus. And to elaborate more on this, I'm joined in the studio by Gernes from PEPFAR, as well as her boss. Good morning, ma'am.
Good morning. How are you?
I'm fine, thank you. Could you please introduce yourself?
Yes, I'm Jennifer Nield. I'm the PEPFAR coordinator.
Wonderful. Let's take a look at the work of PEPFAR for the past year. What were some of your highlights?
I think that we can really look at some of the excellent partnerships that we've had with the government, in particular, in implementing our programming. We've counseled and tested over 200,000 people, sorry, over 300,000 people in the past year, and we've gotten major gains in supporting the government as they do their work.
Yeah. In terms of challenges, Ms. Nield, what were some of your biggest challenges faced?
So the biggest challenges that we face are things that really are dealing with combating the epidemic. So this is a worldwide challenge, and here in particular, we're dealing with stigma reduction. We're dealing with reduction in gender-based violence, which we know leads to a spread in HIV/AIDS. We're dealing with making sure that everybody out there knows their status. So we ask everybody listening today, make sure you know your status and be informed, because those are really the things that stop us from getting to zero. So PEPFAR is the largest investment by any nation to combat a single disease, and we're proud to be here in Namibia, working closely with the Ministry of Health, working closely with the Namibian Government to be able to combat this disease, but we're not yet to zero, and each one of your listeners today and our watchers today can help us really get to zero. So we urge you to be involved in this process.
What is your strategy? What is PEPFAR's strategy in terms of combating the disease?
Moving forward, PEPFAR really seeks to have a more progressive partnership, not only with government, but also with civil society. Our investments here, as Dr. Conway very eloquently put, are important to be protected. We want to protect the gains that we've made. I think we should really highlight the tremendous partnership that we have with government, the tremendous partnership we have with civil society, and the fact that when PEPFAR, having been working here for 10 years now, we've actually halved the number of new HIV
That's
infections.
impressive. That's quite impressive.
It's a partnership that makes that work.
Yeah. In terms of statistics, WHO, that's the World Health Organization, we're looking at 1.5 million people dead, AIDS-related deaths. Is enough being done to curb AIDS-related deaths? Because obviously we're looking into things like, is there enough being done in terms of treatment?
Sure. We're not yet to total control of the epidemic at this point, and so we know that there is work to be done, and that's why the United States government will continue to invest here in Namibia and worldwide to make sure that we can get to zero. So it's important that we are involved in this process. Namibia can't do it alone, and nobody in the world can do it alone. And so we have to work together to be able to achieve an AIDS-free generation. And we're proud to be a part of this fight. And so we're here working and doing our small part, and we're working to be able to fill the gaps as those are needed. And so as the Namibian government identifies needs, we're here to be able to fill those gaps.
Yeah. One of the saddest things, of course, about this disease is that there's no cure. So apart from the ARVs, apart from the antiretroviral drugs, what else can be done in order to ensure that infected patients live a longer and a healthier life?
You know, I think that's an excellent question, and it goes back to something that Honorable Conway said. 10 years ago, HIV was a death sentence. It isn't anymore.
Yeah.
It isn't anymore. People need to be tested. They need to know their status so that they can access the
they can
treatment
get on that
need.
treatment, yeah.
Correct. And the government here has played an immense role in making sure that the treatment is available to people.
Megan, how will World AIDS Day be commemorated today?
Sure, we're excited to have this day, and not only a day, it's actually going to end up being a full week of celebrations.
Good.
So today we're happy to announce that New Era newspaper on their website will launch an interactive game to know the facts about HIV/AIDS. We've partnered with them, and that website will be launched today, so we encourage you to go on New Era's website. We've worked with NBC to be able to create a documentary.
Yes.
So, and that will air today. In addition, our ambassador will be today going to the launch of our new statistics that you discussed with Dr. Conway. And on Thursday is going to be the very big event up in Katutura. There will be a walk beginning from Soweto Market down to Independence Arena.
Oh,
and we'll be involved in that march. And our U.S. ambassador, as well as Dr. Jennifer Nield and myself, we will be walking in that march and participating in the fun day that will happen at Independence Arena.
And we encourage all people to come out and join us. It'll be a really excellent event.
Excellent event. Thank you very much for coming in and talking to us this morning.
Thank you.
That was Megan Gernes, the Small Grants and Communications Officer at PEPFAR, as well as Coordinator at PEPFAR, Dr. Jennifer Nield, speaking to us about the strides that have been made in terms of combating the HIV disease, as well as World AIDS Day, and all of the activities that will take place with regards to that event for the rest of the week. We'll take the 7 o'clock news with Leonard Vitbian. Don't go away.